I'm so excited that this day is here. I'm ready to give a shout out to everybody on this call who, given everything that's happened in 2020, how weird it is, this is a shout out, well earned. So I'm excited to share with you guys what Children's National Hospital Foundation experienced this year, going virtual with their Race for Every Child. This is the team that I was just talking about. We have Megan Rouse, our consultant extraordinaire, Otis Fulton, our psychology expert. He'll talk about those pieces that he brought to the table. There's me. I'm a strategist and account executive here at Turnkey. And then there's Erica, our amazing point of contact at Children's National. So you guys will be hearing from her a lot on what she did to turn her event around this year. Wanted to open up to everybody where we started this conversation last year, which was similar to a lot of other organizations. And that was, do we cancel the event in 2020, or do we try to do a virtual event, a virtual 5K? So Erica and Megan, if you guys could talk about how you approached that question, and then we'll have Otis chime in with the psychology pieces as he gets there. So Erica, give us the lay of the land, I think, from your leadership and your team's perspective when you were approaching this question.
Yeah, absolutely. First of all, also, thank you to everyone for joining this conversation. I think that that's where it all started. So it started out by having these conversations from the very beginning. I think we were all in the very same scenario where we were facing a lot of uncertainty, and with uncertainty there come a lot of possibilities, but then a lot of fear as well. And at the time that we needed to make this decision to go virtual, we were just at the height of a lot of these unknowns, including what in the world is a virtual 5K. We couldn't, we struggled on defining it. There weren't that many examples of what that looked like. So that definitely was a big question. And then also, what would the ROI be? What were we facing in terms of staffing? And then what would be our return on investment? So those are definitely two questions that came up many times. I would say when it came down to it, really understanding that we needed to provide some opportunity to our supporters and be able to give them that chance to remain connected with us, both on a financial level and then also on a social level, ended up outweighing everything else. And so I would say that that's where the conversations went. We took the leap, and once we made the decision, it also became, okay, now what does it look like? Are we preparing for both scenarios? Are we preparing for one more than the other? In person, is that at all an option? But once we did 100% go into virtual, the next steps became a little bit more, I guess there was a path that was a little more clearly defined.
Megan, so from your chair, you came into this and you had, Erica as one client, and you had other clients with maybe not a 5K. Can you talk about what the event type piece had an impact on for this conversation to go virtual or not, and what kind of variables needed to be looked at?
Yeah, absolutely. So one of the things that Eric and I talked about initially, kind of even before we even got the green light to say, yep, let's take this virtual, whatever that will mean for us, is we work alongside of a really large client, which I'm not going to be able to say the name of on this call, but they do a marathon weekend. And a couple of years ago, they had to cancel that marathon because of bad weather. So it wasn't even in their capacity to have it. There was ice, there was snow, it was unsafe to have this race. Then next year, they were 25% down in registration. And it wasn't even their fault, all because they didn't have the race before. And so Erica and her team have done an amazing job of building up this event, this time to get together, to celebrate, to raise funds. And we didn't want them to lose that momentum. So that is definitely one of the reasons I won't say we pushed, because I would say Erica was the internal pusher of I don't want to cancel. We need to have something for our people. The second part of that, I think, once we decided that we were going to go virtual, and again, whatever that means, is we had to decide what that meant for this organization. And so we talk a lot about it, and I'll just give you a little preview here and we'll talk more about it later. This joy factor. There's some type of joy I get from coming to your event. And again, we'll dive into this more, but we were going to have to replace this joy, whether that was race day or the kids dash, or there's so many amazing components of this event, in a virtual setting. So that was something that Erica and I kept top of mind the entire time from start to finish. Was we want to make sure that everybody that comes to this event in our virtual setting walks away with that joy completed for them.
And Otis, from the psychology standpoint, we brought you into this conversation very early. Can you talk a little bit about what psychological principles kind of drive the need to make that decision?
Well, I like Megan's term, joy factor, because attending these events is related to a real sense of emotional connection for people. And not being able to have these events, to share them with other people, feels like a real loss at a time when people are already feeling really isolated by COVID. And it's just gotten worse and worse, of course. Many at the aspects of an event are volunteer run, and they put in a lot of time and effort. And people very legitimately grieve the loss of things they've worked very, very hard on. So, canceling really has some devastating effects. So going virtual, is really a great option. And, to my mind, to survive this kind of a crisis event, the organization's got to really clearly communicate in order to minimize the risk of, the risks that are associated with canceling. So communication is key. I saw one of our clients, unfortunately, they were running some copy by me, and they were talking about canceling their event. And it started out, "This is to inform you that." And that's the kind of language I get when I bounce a check at my bank. This is to inform me that you bounced a check. So, I rewrote their copy and I said, "Hey, got some bad news. We're bummed. I know you're going to be bummed too," because that's the way you talk to a friend and so forth. So we're going to be talking more about how Children's National communicated, and I think that was a huge part of their success.
Otis, will you talk a little bit too about what happens when I alluded to the stat from one of our partners, but when you cancel an event, like what are you actually telling your folks, or what happens there when I say, "Nope, it's not going on this year"?
Well, the canceling an event, unfortunately, is kind of psychologically related to canceling the need for the mission. And so these are two kind of discordance tones, if you will. So, you've got to be very, very careful when you're canceling an event that they understand that the mission has got to go on. So, canceling to me, it really just begs you to find some kind of an alternate solution, because it's really the mission that's of the utmost importance to people. And that's why they're involved with your organization. So you've got to give them another avenue in order to accomplish what they want to do for your mission. And that's why they're there in the first place.
So Otis or Megan, you can chime in here. If some people who are listening today have no choice and their event was canceled and they're looking at 2021, what would you recommend that they do to help counteract that potential 25% loss, for example, of recruitment?
I can go first. And again, we're going to dive more into this. If you had to cancel an event, and I love the way Otis frames that, it stinks. Like, we don't want to do this. We want to get together. We want to keep this mission moving forward. One of the things I will encourage all organizations, and Eric and I are going to dive into how we did this for Children's National, is everybody on the phone, you are so brilliant. You are smart. You are strategic. I'm sure you can come up with the greatest things in the world to connect your participants, your constituents, to a virtual event or to your mission or whatever that might be. You have to talk to them. So if you've canceled something that people love, this is such a great time. And we've talked about this all year at Turnkey. People are actually answering the phone now. It's such a great time to talk to your people and say, what do you want? What do you like? How do we get you involved? What would you want to see? Again, you're brilliant. You can create something, but if there's no buy-in from the people who just love you, I don't think it's worth it.
And last question on the decision out of the gate. Erica, can you talk to us a little bit about the context of being a hospital, a children's hospital foundation during COVID? I know you guys had to react pretty quickly on the ground for testing centers and that sort of thing. How did the Race for Every Child conversation fit into the COVID conversation and making this decision?
Yeah, I would say, tying it back to what Otis was sharing is that by being a pediatric hospital, one of, the first ones to offer testing sites to our community, certainly that we were deeply connected with what was going on in everyone's everyday life and in everyone's conversations and everyone's just situations. And so I think tying it back, it was that perhaps more than ever, we needed, people's support to be able to do what we were doing at that immediate time. But then additionally that in it, separate to that very big piece, we were still treating so many patients with so many other, conditions, and some of them very, very serious. So not because of a pandemic did our mission halt or need to stop, or what might it be, but it was heightened that the importance of people's support was ever more needed.
If I could just add to Eric, I think that when I was writing copy for you guys for your campaign, one of the things I picked up immediately on was that you were testing 150 to 200 kids a day for COVID, and that you were also doing research on kind of a rare childhood reaction to COVID, and you hadn't lost any patients. So, people have felt powerless during the last 8 months. And so what we tried to do was to give them a reason to feel empowered by working with Children's National Hospital and supporting Children's National Hospital. So, if your organizations out there have a COVID tie-in, great. If not, that's fine too. It's that, empowering people that's really, really important. And it just was easy because they happened to be treating, dealing with kids who had COVID and testing COVID and so forth. So that was a big part of the message.
Alrighty, so from there, after all of those pieces were put together, the Race for Every Child virtual edition was born, and we got to work. We rolled up our sleeves and got to work. So what I do want to highlight before we move forward is pause quickly to share with you guys that we had some really great wins during this, but we also had some challenges and some bumps and bruises as we built this car while we were driving at full speed down the road. I mean, this was all turned around very quickly. Normally, I think Megan, you were saying normally this kind of an engagement would be 9 to 12 months longer than what we had to work with in 2020. But again, I just wanted to take that time to highlight everybody on this call who worked really hard to make this event a success so we can share it with you all today. So once the decision was made to go virtual and we had kind of clarity on where we were headed, we had to set some goals. And I will let Megan and Erica touch on this quickly, but we had to really incorporate all of the best practices that everybody had in their back pockets to make this a win. So Megan, how did you approach, with Erica, the conversations around setting goals when no one had any numbers to work off of?
Yeah, and Erica, I'll have you chime in here. So Erica and I were given revenue goals. These are the numbers. If we're going to do this, you got to hit these goals. And Erica, you can talk a little bit about where those numbers came from. But when Erica and I sat down, like Kate said, typically Turnkey likes to build out the playbook and then we go and execute it. Erica and I were working together on execution while the playbook was being written. So as we started working on the goals, we knew that we had to raise this much money. And so I, with our analytics arm of Turnkey and some input from some other clients, we took our best guess, and we didn't guess correctly. So when Kate talks about those lessons learned, we watched the trends of this event the last several years, and we looked at kind of average fundraising, and we felt confident between all of the smiling faces on the screen that if we got someone registered, we could keep them at the same level of fundraising as someone who was either them or looked like them in years past. So we kind of created a trend off of that and basically put what turned out to be a super high recruit goal out there. The recruit goal was significantly lower than years past, again, with the idea that, hey, fundraising is going to be flat. People are engaging in a virtual way. We're not going to have necessarily some of that joy they've had before. Or it's going to be joy in a different ways. So we're not sure fundraising will go up. So here's the number we're going to focus on recruiting to hit these revenue goals we've been given. Erica, can you shine a little light on where those revenue goals came from?
Yeah, certainly. So they were definitely a lot of internal conversations. I spoke with a lot of my peers in the industry and just started to get an idea as to what others were seeing, if they had spring events, or what others were planning for if they had later events. And we did cut down our goal, our overall goal, by quite a bit, trying to be conservative, but also still, build some momentum and bring in revenue for the hospital. So it was a little bit of everything, I would say, and certainly based off of thinking of those lower recruitment numbers and the average fundraising dollars from years past, which, as we'll probably talk about, were not too accurate always.
Right. So
the one thing, Kate, sorry, if I can add, and to your point too, Megan, when we were noticing the trends, we did take a moment to step back and reset our goals. And I personally believe that that was a really, was one of our wins, is being able to say, okay, this isn't looking like what we expected or what we were shooting for, but by lowering our recruitment goal, I believe we allowed ourselves to really push ourselves even more toward a realistic goal based off of data, based off of numbers. And that allowed us to have and see smaller wins along the way that then allowed us, it's almost like a snowball, right? So it gave us more, a sense of more control, a sense of more empowerment, and that energy then translated to how we were speaking to our team captains in our coaching conversations. So I would definitely say not to shy away from taking a step back and repivoting if needed, whenever that might be necessary.
Yeah, to that, we never changed that event goal, that revenue goal, but we changed kind of how we got there. Yeah, so you're exactly right.
Oh, okay. So you guys, the event goal of 600,000 stayed steady, but the number of people that we thought we needed to get to that goal is what changed in real time.
Correct.
Yeah. And we did see that across a lot of our clients that for the most part, the $0 fundraisers weren't coming back, or there weren't as many this year. So I would say that that's been a trend in the industry, and you guys just reacted to it in real time when you came across it. So Erica, this is your moment. Do you want to share with us how over goal you guys ended up being?
Yes. So as you can see, our goal, our financial goal overall, counting peer-to-peer and our corporate sponsors, was 600,000. And we certainly surpassed it. I would say that gap became bigger and bigger the closer we got toward event day. And so there was definitely this rush of excitement and rush of momentum, and people were just proving what we had hoped would be our response, which was that was something that they needed, and that though everyone's financial situation was definitely different than in years past, that they wanted to show up for us, wanted to show up for their team members, for each other, for their families. And so it was certainly something that we were all celebrating, not just internally, but in our conversations with our team captains around the time of our event, and then even in our conversations afterwards. So definitely something that we are very happy about, a highlight, a little light at the end of the tunnel for sure.
Gotcha. If you guys have questions specific to what we're talking about, please send them in through the chat just to give everybody a high level overview. We're going to go around the room and talk about each person's part that we brought to the table for this project. Then we're going to go through what the pre-event activities looked like and the strategy around them. And then we're going to go through what event day looked like. So I just wanted to let you guys know that's where we're going with the conversation. So bring questions on. And this is so fun, as our wonderful Tessie was helping to put this together for us. She took a screenshot of what your fundraising level was as of yesterday. So even just since we scheduled this webinar, your numbers have gone up. So I wanted to give you guys a shout out here. You're at 891 now. All righty, so around the room. So Erica, can you touch on your experience with working with Turnkey and also your internal efforts and wins? I know your marketing team just knocked this out of the park as well, as a huge contributing factor. So can you just talk about the people that were in your corner?
Yeah, absolutely. Well, I'll have to say, I would say this even if you guys were on this webinar and on my little Zoom screens, but definitely working with Turnkey, I could equate to almost having a sports coach who has all the plays memorized, all the stats in the back pocket. And our weekly conversations were just that. They were almost like coaching sessions for me and my colleagues as well, that allowed us to take it almost at the pace that we needed to. So I wouldn't say that structure would look differently, but looking at week to week helped almost in this time of a pandemic to really stay focused and really take those micro changes that we needed to make in order to maximize our efforts that we were doing on our internal end. And so I would say that the coaching from the peer-to-peer aspect, the expertise that you guys bring to the table, as well as the analytical brain power that you have, and having that be a mutual conversation in terms of what were the numbers that we were seeking for that we could build into our dashboard that would make us feel more equipped and better resourced and tooled in order to continue moving forward was extremely helpful. I'll also say that for us as an organization, this is one of the events that touches the majority of departments in our foundation. So I work on the foundation side of things. We do operate separately to the hospital, but we do collaborate very closely with teams at the foundation and teams at the hospital. So I would say that this year definitely didn't look any different than other years past. And I would say that perhaps even more so, there was a sense of all hands on deck. And we, for the most part, I'll talk a little bit more about this in a second, but for the most part, this was the first year that we opened up the opportunity to coach team captains to colleagues outside of just my team, my immediate team. And so that proved to be one of the most fulfilling pieces, I would say, as a lead staff member for this event, and one that helped to build on the success that we saw later on. I would say my media team was invaluable. So we are a team of 2.5, including me. And from our senior director to my colleague, we really were spread thin, and we were each other's support. From a logistical perspective, they really took on some of the heaviest burdens, I would say, in terms of technically how were we going to execute on the ideas that we were really trying to bring to life. Logistics from delivering on our recognition program, all the way to also managing our project management software and the project that we had created to coach team captains within that. Our senior director was identifying some of those key teams to bring back from years past. And so it really was a hands-on deck in that regard. And however it looked like, it was always with the intention to leave me with the most amount of time for that peer-to-peer coaching. So I would say certainly that played a big piece into it. As I was mentioning, this was the first year that we had colleagues from other departments chime into the world of peer-to-peer coaching. And we had some players from our corporate and community giving team, as well as our major gifts team even, take on some of that role, whether that be with a simple welcome call to some of our team captains that made the most sense based off of their role and their relationships and partnerships. And it could have been that that's where it was left off. And then I picked up somewhere along the line. Our project management software allowed us to really make that transition as seamless as it could have been. But even that was an example where Turnkey really helped us as well. We had a conversation with some of these newbies to the team captain coaching, where Turnkey came in and spoke, and you guys really were a motivating factor. We're able to answer questions that people had, and our team left that webinar or that Zoom meeting feeling empowered, feeling knowledgeable, and ready to tackle on this new thing for them, this new task, right? And then I would say too, as you were mentioning, Kate, working with our marketing and communications team, I mean, they are just this creative machine, and they were so willing to bring forth ideas to the table that we, had many discussions on. It allowed us to also, because of their links and role as a liaison with our PR and marketing team at our hospital, allowed us to build that bridge with the efforts going on in the hospital. And I would say, that's often such an important piece that is a challenge for organizations like ours, which is maintaining that one voice, maintaining the rhythm, and making sure that we're all speaking the same language, for lack of a better term. And then lastly, I would say that I consider ourselves lucky. I do think it's not the case for all organizations, but we do have close ties with our hospital partners, whether that be our child life department or our volunteer services team over there. And so we've really been able to build relationships there that allowed us to explore ideas such as even like the logistical piece of trying to tie our mission back to this virtual world, and host a component of that virtual race day on hospital grounds with the pandemic happening. What does that look like? How can we achieve that? And they really helped us to make sure that we were really exploring that as an option, and that ended up coming to fruition. So certainly a lot of players, and this year, maybe more so than ever, I feel like it allowed everyone to feel that a little bit of control, a little bit of that personal and professional just connection to the mission and sense of accomplishment. So yeah, I talked a lot, but there are just so many people that really come into play with that.
Yep. All right, Megan.
So I mentioned this earlier. One of the things that we spent a lot of time on in the beginning was really getting feedback from the people that love this organization, not just specific to the race, but the DIYers, the families, the folks that really love us. So one of the reason behind that is we're taking away this activity, this 5K, right? So I'm not paying a registration fee, running with my friends and family, grabbing my banana and possibly a t-shirt and heading home. That does not exist anymore. So what does it look like for us to come together, and how do we give you that joy? Another part of that too is we're now focusing, and we see this all the time from 5K, when you go from a 5K model to a walk model, where now all of a sudden registration is free and everyone can participate. You really start to narrow down on the lovers of your organization. So now I'm not coming because I love the event, I'm coming because I truly either care about this mission personally, I care about my friend Otis who really cares about this mission, or whatever that might be. I now have a connection of some sort. It costs nothing for me to come to this thing. So now there's a bigger call to action of, okay, we need you to go ask for money. You're coming to this for free. So taking in all of that to account, how do we create something that is engaging and stands out in a virtual world? I don't know about y'all on the phone, but I have a Zoom sunburn. Like, I miss my family, I miss my friends, and everyone's like, let's do a FaceTime happy hour later. And I'm like, I can't look at a screen. I love you all. I also have nothing to talk about, right? I work all day, I walk my dog, and then I watch a new show. That's my life. Like, I have nothing to give in this virtual world. So how do we create something that brings that joy, stands out in a virtual world in terms of, yes, I want to be part of that, and isn't just, hey, we're all going to do this walk or this run on this day together. Well, I walk or run every day by myself. Like, why? What's different? What do you need from me? What's this call to action? How are we coming together? So we had to solve for all of that. So again, we sent out surveys, and then it's the best part of my job. I got to talk to about, I think it was 10 folks that just love this organization and love the event. And hear from them, what do you like? What do you not like about the event? How are you typically spending your time right now in this COVID world? Are there different aspects or things that we could be adding into this? And then we took all of that information, and that's how we really built the event. So we knew that even though we couldn't all get together, that our team captains wanted to be able to get together in a safe way. Some of them, right? They wanted to be able to do this race. We actually talked to one who's a patient mother, and she's like, oh my gosh, do you mean we don't have, I'm so excited it's not canceled, but I'm not sad about having to get up at 4 a.m. and get my little one ready and get on the metro and get downtown, right? So I could do this race at 3 p.m. Like, there's no rules. I can do whatever I want. And that was exactly what we wanted. We wanted you to participate. We wanted you to feel safe, but we wanted you to feel connected. So whether that was you got your team together in your neighborhood, you logged in virtually, whatever that meant, there was some type of event for you that day. And that's what we helped you create it, but it was really what the individual wanted to do. So again, we looked at that joy factor, and then we listened to our people. What's important to you. One of the things that is absolutely loved about in this event, and also creates the best photos, is the kids dash. It was such a highlight. It was such an important part of this event. So again, we just took that feedback and worked to implement it throughout our virtual offering.
So I will speak for my team at Turnkey on the project management side. So we, my analyst Ryan would he did an analysis at the beginning of the program, so we knew what 2019 looked like, what the context was for that, which Erica could tell you better, but basically 2019 was a huge spike in participation. And the question we were going into 2020 with was, how do we activate all these wonderful people that we just got to sign up? We had a huge spike in participation. And then 2020, really started to happen, and we go, oh no, that's not really where we're at. So we had to reframe. And so what Ryan and I did was we delivered the analysis of the year over year and the audiences that looked like we needed to segment them out. And he was able to provide, weekly lead lists to help Erica and her team of 2.5, really triage and see who to call that week. So what we would do was deliver the people. First, we delivered last year's people who looked like they needed to be recruited to come back this year, like who looked likely to retain, who are the lovers that Megan was talking about, that we should talk to about early on about the way the race looked this year. And then we saw pretty quickly that this year's data was really in a world of its own. So what we started to do instead was look at the people who were engaging, but maybe didn't have the fundraising that equaled it out. So they looked like they should be fundraisers, and they were behaving like fundraisers, but they weren't fundraising. So we were able to segment those lists out and deliver them to Erica, and she could talk more about what she did with the list, how did it get divvied out, and that sort of a thing. But that was something that was really important to us at Turnkey, was to feed Erica and Megan as much information as we could, so they could make those decisions and do with them what they will and interpret that data how they could in that week.
Yeah, I'm sorry. I'm going to add to that too, and then Otis can talk about why this is so special. But one of the things that a huge kudos to Erica and her team, when we talked about that one-on-one connection or that personal outreach, Erica and her team were picking up the phone and calling those team captains. Hey, race is still on. We want you to be part of this. Hey, you've signed up. Here's what you do next. Or so Megan Rouse, who registered, had a personal connection with someone there that was checking on me, that was asking, I had someone directly to go to ask my questions. We created this sense of community in a virtual setting. This is something I think a best practice that we'll be moving on with years to come, but it was personal coaching, essentially, or personal support. We had a Facebook group as well, but we really focused on community leading up to the event and the event as well.
Perfect. All right, and then Otis, can you talk about your piece of the project, your contributions to the effort, if you will, and how the psychology really drove the content of what we were communicating?
Yeah, I had the pleasure of writing all the copy for this campaign, and I'll give you an example in a minute. But picking up something Megan said, number one, I don't think you could overstate the importance of these interviews that she did, and really understanding what people wanted and needed. And from our perspective, in terms of the psychology of it, we don't think of people as donating to the organization. What we try to do is figure out ways that we can empower people to help sick kids, because that's what the people are doing that support Children's National Hospital. So I'll just give you one of the examples. We wrote one of the recruiting emails that we did. We nested it in a survey, and so we used a technique that psychologists call priming. If you're familiar with priming is just reminding people of their positive attitudes, in this case, towards Children's National Hospital. So we sent them a survey by email, and we said, we'd like to know how you think the coronavirus will impact your support for Children's National Hospital. And then we had 3 questions, and it says, please check the statements that you agree with below. And the first one was, because of the coronavirus, Children's National work is even more important. Second was, because of the coronavirus crisis, I'm more committed to supporting Children's National's mission to provide world-class healthcare to kids in the DC metro area. Then the third statement was, supporting Children's National makes me feel like I make a real difference for my community. Now, people just check the ones that they agreed with. They sent in the survey, and then the next day they got a email that said, our survey results are in. They got the percentages, the people that agreed with those 3 statements. Now, these 3 statements are all very pro Children's National Hospital, very positive towards them. So we were reminding them of their positive attitudes. And then we asked them to fundraise. So we said, here are the results. We learned that Children's National community is committed to providing area kids with the best medical care possible, especially because of the coronavirus. And we need you today more than ever. And then we asked them to register and fundraise. So that was one of the little psychological techniques that we used in this case to get them to register to fundraise. And having, over 2,000 fundraisers, that was really a huge success.
So we do have an example email, but before we go to that, Otis, we had a question come in, and I'd love to talk about it now. We had 2 questions come in. We had one talking about, did we have any post-event activities? So we can definitely talk about that when we get to the sequence of, we did this. The second question came in saying, I'd love to do the same thing, but we need help. What can I say to leadership to get them to understand the value of consultants without losing my job, or maybe getting positioned poorly? And Erica, did you have to do this, and kind of how would you approach it? So I'll throw that out to Erica. How did your positioning with that work, if you're comfortable talking about that? And then Megan and I can talk from the consultant side.
Yeah, absolutely. So I would say, that absolutely we, as internal team members, are more directly connected to, like I mentioned, it took a number of different internal teams to help put this together. So it's hard to do that as a third-party consultant. You'd never have that entry point. You'd never have those internal conversations to that extent. And it takes, just as it takes a consultant, as a coach, it takes an internal leader to be able to bring forth any of these ideas. And there has to be a glue. There has to be someone kind of steering the ship. I'm, fortunate that I count on many different teams that are really supportive, and it hasn't, been from the very first day at the organization to the next day. It takes time, just like with our team captains, it takes time building these internal relationships, and that is invaluable. And on the flip side, it really takes sometimes an objective opinion, and that third party voice that's also working with other organizations, really providing that outsiders expertise and viewpoint when you're, just kind of sometimes in a tunnel vision of what you're doing, that you can have those blinders toward the other world of possibilities. So happy to kind of chat with anyone who's willing to. I don't have all the answers, but that's part of the process, and it's really continuing to learn what it does take to get to the next week and to the next week. So yeah, absolutely, great question though.
Yeah, Megan, how about from your chair? I know you've worked at the nonprofit side, and you're now a consultant, so you can maybe answer from both sides as well. In your experience, how do you present the possibility of working with a consultant to leadership?
Yeah, I think, and I'll maybe a little story. So I actually do some personal development leadership coaching in my virtual free time. And every time I have a lesson with my coach, I come back, and my husband knows me better than anyone else in the world. And I come out and I say, "Oh my gosh, did you know this about me?" And he goes, "I have said this to you 15 times. And I'm like, "Yeah, but now this person is telling me this in this setting." And it's like, light bulb has gone off. And so for me, that really, I don't know why that experience has kind of like equated to a consulting for me. As a consultant, our job is to, make our client revenue, obviously. And also too, like, Erica's the hero, Erica's the champion. We have to support her. And it's this fine line of wanting to be the hero, but also not trying to get fired, but we're trying to push the boundaries a little. So I think it's nice in terms of presenting it to leadership of, one, sometimes we're just too close to it, right? Or for these interviews, for example, there's a reason Erica didn't get to conduct these interviews. She has relationships with these people. So now there's a third party who, you can be really open and honest with. So I would say that a consultant just can complement a lot of the things that your staff is doing, and sometimes just see things in a different light. When you work with an organization like Turnkey, for example, we came into that conversation with leadership with the statistics Erica was talking about with proven, that was our favorite question during COVID. Do you have a proven track record of success during a global pandemic? No, we do not. But we think that these things will work, and here's why. So, I think internally people have to be open to it. So like Erica said, there has to be a champion internally. Otherwise, a consultant will never come into an organization. But then I think as a consultant, you have to be able to show you're going to work. If you work with us, here's your expected ROI. And I think the way that we laid it out in the partnership we have with Erica and her team, it was just a no-brainer to do it.
Yeah, and I would say, just to add on to that, a good consultant will make people at all levels in the organization feel comfortable and supported and taken care of, because we do want you guys to be the winners. So if that does not quite answer your question, please reach out to me or Erica. We could talk ad nauseum about that, about our experiences and the different ways we've had to pitch things to different types of leadership. And happy to customize that answer a little bit more for you. All right, so I wanted to move on to Otis. This is an example of an email of a way that we approached the content piece. So Otis, do you want to talk about this? We only have about 5 minutes to get through event day and pre-event, event day, and post-event information.
Sure. I'll just take just a few seconds on this. This was actually the email that we sent out, the CNH sent out, that we wrote, talking about how the event was going to change. And I think that, again, this is as the results proved, this was so much better than canceling. Finding another way. The only part of an event series that's not virtual is the event itself. Everything else leading up to the event, recruitment, all this fundraising, it's all done virtually. The only thing that's not virtual is the event. So, we reassured people that there would be an event here. It just wasn't going to be the same event. So I think that got us off to a very good start.
All right, Erica, can you take us through what the pre-event series looked like really briefly, knowing we're going to send this out to everybody to have?
Yep, absolutely. So we, upon Megan's recommendation, we did work hard to build some pre-event presence, an opportunity for us to stay engaged and top of mind leading up to the race. So that took the shape and form of having a peer-to-peer focused webinar in August, our race rally in September, a team captain kickoff as well prior to those two. And then what we then labeled as our Spirit Week, which started the Tuesday of our event week. We were lucky that we were able to, count on some last minute partnerships. So as you'll see there with the Wednesday item, we had a former football player from the area come forth and say, hey, I'm interested in supporting. Is there any way that I can do this year? And the way that looked like was we had him and his wife, who is a physical trainer, record a video with their family. And it was this very organic, very just, basic video that they provided that made it just seem like it was so natural for them to be a part of this cause as well as it could be for anyone else. And then one of the other things I'll just lightly touch on that we did try to do with these pre-event activities was to really pull out some of those team captains that we've had relationships from year past and that were even more so engaged for this year in its virtual edition, to take on a heavier role or a more formal role. And one of those was our anesthesia team, and they provided a video that almost highlighted a day in the life. And it was just a different way for us to recognize that team is always there for us. They always do really energetic and creative things on their own to pump themselves up, that we wanted them to be a part of this in a different capacity this year. And then our creative team from our Marcoms group really helped to bring this all to life. So this is the graphic that they created that we then were able to disseminate via email and our Facebook group and other channels. We attached it to emails, pushed it out to team captains. So it really took a full circle.
Yeah, this provided momentum going in. Again, we have a virtual event. What does that mean? So this provided us momentum going into that. We saw fundraising spike during this week, which was awesome. Now we're also pushing people to social. So you're engaging with us in a different way. Erica's team was able to capture a lot of really great content before the actual virtual event itself, because people were using the hashtag, because people were taking part in Spirit Week. So again, it added to that virtual community. You're seeing it in your newsfeed, and really added some momentum going into the race day.
Yeah, I was gonna ask that. Before event day, you guys had already achieved the goal of 600,000, correct? Did that happen after this Spirit Week?
We reached that probably a week or 2 weeks prior to. Mm-hmm.
Amazing.
Yep.
All right. And then event day, Erica knows I feel very passionately about event day. It was 26 of the best minutes of my life. I will say I laughed and I learned more information and I cried a little bit. So it was just beautifully done. So Erica, can you talk about how, and we will send out to everybody the event day recording so you guys can see how Erica's team managed the recording piece. So Erica, high level, you've got a minute to talk about event day.
Go. All right. So I would say this photo, for example, is from our healing garden. So again, we were really trying to find the connection with the hospital, and we were following all of the protocols needed. But these are two of our patients, and they were co-MCs. So we gave them the role of being co-MCs. We had one of our local news anchors be the primary MC, and she really was absolutely outstanding. So I think choosing the right people is definitely very important. Tying it back to the mission is important. But this little guy really, was the star of the show in so many different ways that it helped to bring why we were there all together. We also tuned in to one of our top team captains who won the opportunity to have our hospital mascot, Dr. Bear, as part of their personal walk and run. And I was there with that team captain live. So we, switched from, I would say, probably 3 different scenarios or 3 different Zoom buckets to that live with the family in person at their home, and kicked off the event from there. So the only other thing I would add that we ended up incorporating was certainly that very youth-centric mission or centric messaging, that we were able to say, because of you made this happen. We are here today. We are celebrating with this family. We're able to make it still happen this year despite it all. So definitely from the physical aspect to the messaging that we put out there, it all tied together.
And good question just came in. How does the total of the 890,000 that you raised this year compare to a normal year?
Fantastic question. So it is on a typical year, we would raise 1.4 to 1.5 million. But with triple the participation. So one of the things that we see as just beyond success for us is that we were able to almost triple our individual fundraising averages, and our activation rate skyrocketed. So from 17% last year, it went up to 62% this year, which is just one of the goals that I've been working toward for the last 3 years, 4 years that I've been with the organization. And it's something that we're going to continue to focus on and really be able to work towards. So with a third of the individuals, we raised, 2/3 that what we normally raise. So certainly doesn't quite compare, but we were beyond pleased with those numbers.
And what was the net result? I know that putting on a 5K costs money as well. So can you talk a little bit about the amount of money that you would have spent to have the event with this many participants?
Yeah, so we're still looking at those numbers. I would, because the fundraising is still coming in, but I would say that we were definitely able to save about 200,000 in expenses from not having it in person. And certainly we learned a lot of lessons with, and maybe a separate conversation for this, but with our corporate partners, we saw so many that wanted to continue to support, and then also some that were really looking for those in-person opportunities. And so, we can definitely continue to grow in that realm. If we were to do this next year, we would, hopefully not, but we would know what we could offer more to our sponsors.
Yeah. And I know that we're going to send a chat question out, so we can do that. While Erica, can you briefly touch on what you guys did post-event? Everybody chat in your answers. What's your next one thing you need to do? Maybe after vacation, but what's the next step for you for your events in 2021 or your fundraising and development plan? So Erica, can you talk about what happened post-event?
Yeah. This is probably one of my favorite parts because I feel that it really encapsulates it all, but we were able to gather participants' photos and videos, finishing times, and we kind of continued on some of the traditions that we do every year, which is offer up that finisher results log where you could go and see where you fared against others. And then what we did with all of that content is that we created a video, almost like a montage of everyone's submissions. And it really was incredible to see. I hadn't mentioned this before, but we saw participation from 39 states across the country and 3 other separate countries. And so that to us was also another measure of success. And that video, I think, really captures it really well. There's even this one team captain who is racing in San Diego, and she's, this sunny video with her DC flag shirt and just this heartwarming message out to her family and friends in DC, and that she's doing this all the way across the country. And it just is one of those examples of like, okay, we're seeing this from all over.
Mm-hmm. I will highlight that Julie, I didn't want to put you on the spot, Julie, so thank you for volunteering, especially for the question about maybe putting something like this in front of leadership. Julie would be an excellent person to talk to about that. So yeah, thank you, Julie. I really appreciate that. All right, so we've got about 60 seconds. Oh yes, Patrick, great answer. Go around the room, what's a win, an unexpected win you got, and what is a lesson that you learned? So really brief, 1 sentence each. Otis.
I'm sorry, come back to me in a moment.
An unexpected win or surprise that you had through this experience, and what was one lesson learned? So one really quick each.
Oh, gee, put me on the spot. It was so great writing copy for Children's National. I learned something every time I write copy for an organization, and I think I learned double or triple writing for CNH. So I appreciate the opportunity.
All right, Erica.
I'd say this isn't exactly tangible, but energy is contagious. So I think when you're able to talk to your team captains with that energy, when your team captains can talk to their family members and friends to recruit, that's contagious. Speaking with leadership is contagious. And then it helps to tie everything else together and helps move things forward. I would say something that I learned personally is definitely to work toward making decisions a little bit quicker. I think that by just identifying what you really believe in and coming to that conclusion earlier on, it allows you to have more time to test the possibilities. So, anything from an idea to a technical execution-based next step really will give you more space to do other things and really just not stay stuck, I guess.
All right, and Megan.
Yeah, well, I think this is just a great example of it's possible, right? So we can connect people. And what I love about this, and Erica mentioned it, is people from all over the country participated. We were going over the data with Ryan, our data analysis. He kept just saying, wow, this is so much higher than fundraising benchmarks that we've seen. Wow, wow, wow. Like we crushed it. I will say that, and I'm surprised this, I'm going to steal this from Otis, from our good friend Jin Sheng. When you're thinking about whether it's a physical event or a virtual event, which would apply, I think now we've created there's gonna be a blend moving forward, right? People demands are higher, but when you're thinking about what your organization is gonna do, you need to answer the questions, 2 questions. What are my people currently feeling right now? And what is one thing that only my organization can give to them? And so I think that will really help. And you may not be able to answer that. You're gonna have to talk to your people to answer that, but it really helps, is the recipe to success for a lot of this.
Alrighty, thanks everyone. We are slightly over time. I apologize. As you know, there are tons of moving parts to this, so please reach out. Erica and I and Megan and I can have a coffee with you and offline and just talk about any variables for your personal program, because the answer could be different for every organization. So we are here to support you. And congratulations again, Children's National, for doing such a great job in 2020.
Thank you all so much.